So we have another question here about long COVID symptoms, PANS and PANDAS, and LDN implementation and benefits dosing guidelines.
As Shalin had mentioned before, any process where there is an inflammatory component to it, naltrexone has the potential to have benefit. And so we know that long COVID and what it's doing in the body, a lot of these patients having increased production of cytokines that we talked about earlier, increased production of the interleukins, and like Shalin had mentioned, low dose naltrexone turns off those toll-like 4 receptors on those microglial cells, which then helps to decrease that cytokine production. So potentially, we are reducing the inflammatory processes that are caused by those viral infections that are happening. As far as with, PANS and PANDAS, same type of thing. With those type of infections always comes an extremely large amount of inflammation. I've seen the lab work before for PANDAS patients, and their inflammatory markers are literally off the chart. I mean, they're so high that they are immeasurable. And I have worked with, a couple of physicians over the years who specialize in PANDAS, and they greatly utilize low dose naltrexone to help tamp down those inflammatory processes that are going on that's caused by these infections for these patients. So, again, same with dosing guidelines, we always recommend starting extremely low and going slow, especially someone who is struggling with, either a viral or a bacterial infection at the time, because, we just don't want to overwhelm their system by titrating up too high too fast. So again, starting out 1.5 milligrams or lower, even 1 milligram, a half a milligram, even 0.25 milligrams. Now we're getting into those, ultra low dose ranges. Certainly doesn't hurt to start that low and just work up very slowly. A lot of times too, when patients have these infections going on, and these viral cells start to disintegrate, they start to leach out all of their toxic contents into the patient's bloodstream and into the patient's system. That causes a whole nother cascade of inflammation as well. So I definitely think there is a great opportunity to use low dose naltrexone in those patients, and again, just starting very low and working up slowly for them.
And I think that can go into our next question as well when it talks about going, oral therapy to sublingual therapy. Sublingual, obviously, you're bypassing the first pass metabolism. If it was me recommending it, I would probably have the patient maybe decrease their dose a bit, maybe even just for a few days, to see how they're going to respond to it before you increase back up. So again, start low, go slow, and when you're changing dosage forms, it wouldn't hurt to go back down for a period of time to see how that patient is going to react to the medication before increasing back up.
And on the LDN Research Trust website as well, we do have LDN guides. We have a patient guide, a prescriber guide, and a dosing protocol guide. And they are at the moment now being worked on and updated.